Welcome to The Explainer. Today we're going to tackle a really important topic, eating disorders. We're going to cut through some of the noise and the myths to really understand what they are, what to look out for, and most importantly, what the path to recovery looks like, using insights straight from the National Institutes of Health. So let's just dive right in with the question that gets to the heart of it all. Is it a diet or is it a disorder? I mean, we are all swimming in a culture of diet fads and this constant pressure to look a certain way. So where is that line between, being health conscious and having a serious life-altering illness? And right off the bat, here's the most critical thing to understand. What you're seeing here is the absolute truth of it. We are not talking about a lifestyle choice. We're not talking about a diet that's just gone a little too far. These are complex, life-threatening mental illnesses that can actually rewire the brain and have just devastating effects on the body. So to really get a handle on this, we've got to frame it the right way from the start. This isn't about someone's willpower failing. It's a matter of brain chemistry, it's psychology, it's a legitimate pathology. So what are we actually talking about? Well, here's the clinical definition. And notice, the key words here aren't really about the food itself, it's about the relationship with food. It's the significant disturbances, the obsessive thoughts, the compulsive behaviors, and these overwhelming emotions that can completely take over a person's life, their health, their relationships, everything. And if you're still not convinced how serious this is, just look at this number. Young people between the ages of 15 and 24 with anorexia are 10 times more likely to die than their peers. That fact alone gives anorexia one of the highest mortality rates of any mental illness. We're talking about a truly dangerous condition. Okay, so let's break this down a bit. We're going to look at the three most common eating disorders. And while they can definitely overlap, they each have their own very distinct patterns and characteristics. First up, we have anorexia nervosa. And really, the heart of this illness is this intense, all-consuming fear of gaining weight. And it's paired with a distorted body image. What that means is a person with anorexia can be dangerously, severely underweight, but when they look in the mirror, they genuinely see someone who is overweight. Next up is bulimia nervosa. Think of this one as a really vicious cycle. It starts with what's called a binge, eating a very large amount of food, often with this profound feeling of being totally out of control. And that binge is immediately followed by this wave of intense guilt and shame, which then leads to trying to compensate or undo it through behaviors like purging or exercising to exhaustion. And finally, we have binge eating disorder. And, this one is actually the most common eating disorder in the United States. It involves those same distressing, out-of-control binge episodes that you see in bulimia. But, and this is the crucial difference, those episodes are not followed by the regular use of compensatory behaviors like purging. Okay, this chart is so important because it just shatters a huge myth. Take a look at that top row, body weight. Notice that only anorexia is consistently linked with being significantly underweight. People with bulimia or binge eating disorder can be of a normal weight or even overweight. This is why you cannot tell if someone has an eating disorder just by looking at them. It's a huge misconception. So, if you can't always see it on the outside, what are the warning signs? Recognizing these is absolutely the first, most critical step. So let's break them down into two buckets, the physical signs and the behavioral ones. The physical damage is just devastating. When your body is starved of what it needs, it starts to make some tough choices, shutting down things it considers not essential, just to keep you alive. That's why you see things like thinning bones, brittle hair, muscle wasting, and this constant feeling of being cold. And some signs, like worn tooth enamel from stomach acid, can point directly to specific behaviors like purging. And that's just the physical side. The internal battle, the one you can't see, is just as brutal, if not more so. The disorder can completely consume a person's thoughts. Their entire world can shrink down to this one preoccupation with food and calories and weight. And that obsession often leads to things like secrecy, eating alone, and this really profound sense of guilt and shame that can isolate them from everyone they love. So, what causes this? Why does this happen to someone? Well, there's no single, easy answer. It's not that simple. It's much more like a perfect storm. A whole combination of factors that all come together to create this high-risk situation. What the research shows is it's this incredibly complex mix of, nature and nurture. On the nature side, you've got things like genetics. It can run in families, or even differences in brain chemistry. And then on the nurture side, you have psychological traits like perfectionism or high anxiety. And of course, these are all amplified by these huge cultural and social pressures that glorify being thin and push these unrealistic body ideals. And I really want to be crystal clear about this next point because it is so important. The stereotype that eating disorders only affect young, thin, white women isn't just wrong, it's dangerously wrong. That stereotype prevents so many people, men, people of color, people in larger bodies, older adults, from getting the diagnosis and the help they desperately need. These illnesses do not discriminate, period. Okay, now for what is honestly the most important part of this entire conversation, recovery. Because even though these are severe, life-threatening illnesses, the good news here, the really good news, is that healing is absolutely 100% possible. And I love this quote from the National Institute of Mental Health. It's just such a powerful message of hope. Now, the road to recovery can be really long and incredibly challenging, but it is so crucial for people to know that a full, healthy life is possible, even for those who've been battling their illness for a very, very long time. So how does treatment work? Well, it's not a magic bullet. There's no one-size-fits-all fix. Instead, what's effective is this coordinated team approach. As you can see here, it takes a whole team. Therapists to work on the underlying psychological stuff, medical doctors to make sure the person is physically safe and stable, and nutritionists to help literally rebuild a healthy relationship with food.
So let's drill down on a couple of these strategies because they're really key. Cognitive behavioral therapy, or CBT, is a real cornerstone of treatment. It helps people identify and then change the distorted thought patterns that are fueling the disorder. And for adolescents and younger people, family-based therapy is often critical because it empowers the entire family to be an active part of the healing process at home.
And that brings us to our final question. And it's a big one that involves all of us. Understanding the illness is step one, for sure. But what's our shared responsibility here? How can we, all of us, help build a culture that actually values health over just appearance? A culture that supports bodies of all shapes and sizes, and maybe most importantly, a culture that finally gets rid of the stigma that stops so many people from asking for the life-saving help they deserve.